Hello, 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 everyone. Welcome to another episode of Sree's daily global COVID-19 conversations. My name is Sree Sreenivasan, and I'm honored to gather this global conversation every single day that we've been on lockdown here in New York City. I'm coming to you live from the Upper West Side of Manhattan, where we've been locked down for 84 days. That's right, this is our 84th straight show, including weekends, since we've been locked down. We are doing this conversation so that we can learn from people around the world on so many different topics. Tonight in America, the fight for social justice continues as we focus on the news that's coming out of Minneapolis, as well as the racial unrest all over the country. The protests are front and center, as well as the leadership or lack thereof in Washington, D.C. Tonight, we're also going to make sure we pay attention to another topic, which is the issue of the global pandemic that's going on. That turns out to be a story of racial inequality as well. As many of you know, there are cities and states in this country where the population of African Americans is 10, 15, 20%, but the percentage of people who have the coronavirus is at 70, 80% are African American. That tells you there is something wrong in the healthcare system as well, not just in the criminal justice system. So we're going to talk about a lot of these topics tonight. First, we have a very special guest who is joining us, and we're very grateful to him for being here. Professor Keiji Fukuda is here. He is the director of the School of Public Health at the University of Hong Kong, and where he's been for many years as one of the leading experts on issues around public health. He's also been a former senior executive at WHO and at the CDC. It's a very rare combination of skills and experiences that he has. We will come to him in just a minute. Before that, we want to thank our sponsors of this show. First, we want to thank Art & Company, artandco.net. Get involved with the world's largest online art collection, the world's largest online art collection auction that's happening for fundraising for COVID-19 victims. Art & Co. We want you to go to artandco.net, and you can see how they're raising money for COVID-19 victims. 6 organizations are being helped. This is based out of London, and they are sponsoring the show because they want to get the word out. Art is a worldwide phenomenon, and you can participate. Please share this with your friends and family, especially any art lovers there. And we also are very grateful to our friends at Muckrack Academy for making my Fundamentals of Social Media course free and available to everyone. It's a free certification course, starts in the middle of June, but you can sign up today. Take a photo, take a screenshot, and share this with your friends. It's labeled journalists and public relations professionals, but everyone in the world can benefit from this, any age, any background, any level of experience. Our friends at Muckrack Academy have made this free to the world. More than 3,500 people have already signed up, and we are going to get more people coming in. So please go to mrac.co/social, mrac.co/social. And with that, let me bring onto the stage our guest visiting from Hong Kong, where it's 9 in the morning. He started a very busy day for him, but he's been very kind to be with us here today. So let me bring on to the stage Professor Keiji Fukuda. Hello, sir.
Hi, Sree. How are you?
Thank you so much for taking the time, for being with us here today. I know we will all learn a lot from you. We did a conversation under the auspices of the University of Hong Kong already, and that seems like a lifetime ago, doesn't it?
It does seem like a long time ago. You're right.
And the world has changed a lot since then. We will be talking about where the pandemic stands right now. We'll talk about how things are in Hong Kong. We'll also talk about how the professor looks at America and the situation here. And we'll also talk about the issues of racial justice that America is trying to sort through at this moment. But I want to start my conversation, as I do all these interviews. Professor, how are you? How is your family? And please tell us that first.
No, we're doing good over here in general. I think that luckily everyone in my family has remained well. and we continue to try to get out and walk around and see friends increasingly now, because we are able to move around Hong Kong more easily than in the past, and so things are okay.
And why do you think that is? We're sort of jealous out here. We've got, setting aside the events of the last few days, just the situation with the pandemic has been so problematic here.
Sure. Well, Sree, Hong Kong is one of the places in the world which I think has been on top of the outbreak from the beginning, meaning that it has really paid close attention. And I think the dividends of that are showing now. We continue to have cases. There have been cases in the past, day or two. And yet, overall, the situation, I think, remains pretty contained right now. And so in this period in which the virus is relatively contained, the city has been loosening up its distancing measures. And so people are out on the streets more, trying to get back to more normal patterns of visiting friends and having meals and so on with people.
That seems so far away for us here in America. And what about the region? Can you talk about that? And of course, the focus on China, where this all began.
Well, when we look at the world right now, it looks like a mosaic, and Asia is part of that mosaic. In certain respects, the region as a whole has done reasonably well. I think a number of the locations in Asia, such as mainland China, Japan, Taiwan, Korea, Singapore, Hong Kong, we've all had our ups and downs, and certainly there have been examples in all the places where the cases have been brought down, but then there have been new cases coming up. But nonetheless, I think that in Asia, the countries in general have been pretty attentive to the outbreak. And again, I think that it's really paid dividends. And so I think that even though we certainly have it, and we certainly continue to be worried about it, nonetheless, this sort of stepwise return back to more normal patterns is continuing in the region.
Well, we're very glad to hear that things are better. We want to just make sure people understand the work that you do. You are you're someone who has an MD and an MPH, or Master of Public Health. You are the Director and Clinical Professor, Division of Community Medicine and Public Health Practice at the University of Hong Kong. And you joined there in 2016, and you became the school's director in 2017. Under you, the school has pioneered a holistic and multi-sectoral undergraduate program on public health and development, and established new research directions such as antimicrobial resistance, and fostered collaborations and initiatives aimed at developing the next generation of health leadership. Right now, how are you doing with your students? How is the classroom situation? Where are we right now in the academic career of your students?
Well, I think like every educational institution around the world, we're trying to figure out how do we bring students back. I think all of us miss the face-to-face encounters. It's nice to do teaching electronically and to have meetings, but it's even better to actually see people. And so we're working back towards that, working to try to get back as close to normal as possible. But I do think that come the fall time, when we really begin the new school year, it will be a mixed pattern of having some things face-to-face, but also doing things differently than we've done in the past. At the university, we're definitely thinking about how do we minimize the chances of anyone getting infected. At the same time, how do we maximize the chances that everyone is able to have a normal university experience? And so that's true for the school, that's true for the university as a whole.
Thank you, folks. You want to participate in this conversation, please tell us where you're watching from, and please ask the professor a question. I want to tell you a little bit more about his background, especially his connection to international health diplomacy. He was for 11 years at the World Health Organization in several capacities, including Assistant Director General for Health Security, Special Advisor to the Director General on Pandemic Influenza, and then a Special Advisor for Antimicrobial Resistance, and as Director of the Global Influenza Program. He led global approaches to health security, including the development and adoption of the pandemic influenza preparedness framework and implementation of the international health regulations, as well as responses to such international emergencies as H5N1, H7N9, and the 2009 pandemic influenza, Ebola, and others. And he was central to the international health diplomacy initiatives that resulted in the 2016 historic heads of state level meeting at the UN and a UN resolution on AMR. And he is often on WHO's main global media spokesperson during those years. And it's so good to be able to speak to you here tonight and in the morning in Hong Kong. As I talk about WHO, you know that what's on my mind, Professor, the anger, resentment, and short-sightedness on behalf of the US governmental agencies, and starting at the very top, saying that first they would cut WHO funding and then withdraw from the World Health Organization. What are the implications of even saying that, let alone doing that?
Yeah, Sree, I mean, this is certainly an issue that every single one of us who's been involved with global health has been thinking about and focused on. You know, in a certain perspective, I think that what the current administration has announced that it was going to do, in a certain way, is not so surprising. Meaning that this is an administration which has, you know, threatened to pull out of NATO in the past. It has pulled back from the Paris environmental accords, and in many ways has not been, you know, a usual partner to these, you know, international groupings. But in a real world sense, it is such an unwelcome move. I mean, even talking about it, because, you know, one of the ultimate truths about global health, and everyone who's worked in this field deeply understands it, is that these health issues that we're trying to deal with, and COVID is a best possible example, you know, really do transcend national borders. And if we're going to deal with them, and it doesn't matter whether we're talking about pandemics or emerging infectious diseases like this, or whether we're talking about smoking and the attempts to address chronic diseases, these are issues which deeply involve the entire world. And so by pulling out of WHO, one, it potentially weakens the global efforts to address these situations. Or I should say, not even potentially, it simply weakens the world's ability to deal with these kinds of issues. But it also fundamentally, and this is one of the difficult things to understand, is that it fundamentally weakens the United States. One of the realities of dealing with outbreaks and infectious diseases in the way that I have for many years is at the heart of every response to them is the need for information. The US is in the same position as every other country. It fundamentally needs information from other countries, from other partners. Some of this information is early alert and warning. Some of the information is technical information, the kind of information that you need to make diagnostics. And some of it is simply a heads up that something may be coming your way, get ready for it. And so the world operates on that basis. That's, in essence, the heart of the international health regulations, which the countries, the member states of WHO endorsed in 2005, and that's what makes it so fundamentally important. So if the US pulls out of that, it begins to exclude itself from that kind of information. And the US cannot exist in a vacuum. It's simply unrealistic. And so why it would harm itself has always been a bit of a mystery to me. But to go back, I think that also the US has been really one of the main voices at the global level for public health. It has provided leaders, it has provided ideas, it has provided scientific know-how, and it has provided funding. And so it was crucial for the eradication of smallpox. It's been crucial for the work to eradicate polio. And again, so many important health initiatives. And so, again, pulling back from that it really is just, it's a sorry state of affairs. It really harms the world and it harms the U.S.
And have you felt that the people like you speaking up has helped at all? Is there any hope? Where are we with this? As we know, the President of the United States often is doing things and saying things on Twitter, but here he seems very serious about this. What do you hear from your friends at the WHO?
Well, I think that everyone at WHO is, of course, hoping that this, this is not realized. I mean, there's not a single person who doesn't recognize how important it is for the U.S. to remain a global presence, remain a global voice. And so I think that a lot of this is going to depend, of course, on the administration and the people working with the administration. You know, the country does not run by one person alone. There are all of the other officials in the government. There are the voices in the country. There's the Republican Party. There are all of these other people who have some voice in what the U.S. does. And so I think it is important for these voices to be heard. One of the interesting things for me in my career is that I have seen how many health issues can become politicized. They can become taken over perhaps by one party or the other. But this issue of health security has always been an issue which has brought Republicans and Democrats together. And because the logic that you really need to stand with other partners, you need their help, and you need to help them, has always been so clear. And so, again, I hope those people who have worked on this area, and this is not scientists, but really the people who have had the best intentions of the heart of the country at heart, I hope they can speak up also, because we need to hear those voices. We need to pull back. Having said that, I think that it is a good idea to assess the performance of WHO. I think it's a good idea to assess how everybody responded to COVID. The impact has been too profound, and we do need to look at how has every country done, how has every major organization done. But it is definitely not the time to pull back from that.
Thank you. Folks, you're listening to a very important conversation with Professor Fukuda from the University of Hong Kong. He is one of the world's top experts on pandemics, and he will be sharing some more of his thoughts. He's also worked at the CDC in America. And by the way, he is American, though he was born in Tokyo. Is that correct? And yes. As was I. We were a couple of years apart in our being born in Japan. My father was an Indian diplomat stationed there. We discussed this in a previous interview we had done, and we're just so grateful to him for being here. We'll also hear about his very unusual story, how his family moved to America, and then he took some time off, which is not often something that Asian families let their kids do, and he did that some time ago. Let's do, Professor, what we call a global tour. We'll see who is checking in from around the world. Jonathan's watching from Union Square in New York. And by the way, as I mentioned, some of these places, if you have any memories or anything you'd like to say, any even meals you've eaten in some of these cities, we'd love to hear that as we think about it. I know you used to travel a lot more than you are now.
Yeah, no, I'm very fond of New York. I have two cities which I'm really fond of, and New York is one of them, because I remember walking around the city when I was in high school for the first time, just walking around, and I don't know, I can still feel the excitement of just going to the Modern Art Museum and seeing movies that I'd never seen before. And anyways, amazing city.
Yeah, and that was, you had come, I presume, from Vermont, is that right?
Yes.
So that would have been a culture change right there. What's that other city you are fond of?
Well, there's a lot of cities I'm fond of, and I'm living in one of them right now. But I also have to say, Paris is a city that is just beautiful. Yes,
it is. All right, let's see. We have Kanika, who's a doctor, watching from Houston. Any memories of Houston?
Texas is one of the states that I haven't spent much time in. I've gone through the airports, but haven't really spent time there. But, when I retire, I'm going to bicycle everywhere. And Texas will be one of the places.
Yeah, there's a long way that you can bicycle in Texas. Diana's watching from the Bay Area.
Well, my wife was in the Bay Area for 14 years. I was in the Bay Area for 6 years. I have many cousins and friends there. I love the Bay Area. It's beautiful.
And you worked in clinics focusing on leprosy and tuberculosis before you moved to Atlanta, at least that's what it says on the internet, Professor.
No, it's true. I did my medicine training, my residency training in San Francisco, but I really had the fantastic opportunity of working with a Hansen's disease clinic. At that time, the U.S. had a small number of leprosy clinics in the country, and one was located in San Francisco. And it's an unusual group of patients, as you might imagine, and they come from all over the world. And so you get to sit with people and just talk about things which you normally wouldn't. And through that, I got to go to Louisiana to do some training in leprosy. And again, you get to meet older people who can tell you what it was like being chased by dogs in swamps when they had tried to, basically run away. And again, an encapsulation of parts of American history that you would never understand without running into people who have conditions like that. And so it's one of the things which really shaped how I think about health, how I think about equity, how people are treated. And it gives you an insight about what it feels like when you're not being treated very well.
And you did your internal medicine residency at Mount Zion Hospital in San Francisco. We should tell you that Diana is part of the communications infrastructure at the San Mateo County Health System. And those folks, as you know, are the front line in those local areas. And communications is so important in this day and age, right, in terms of public health?
Absolutely. I mean, communications is the heart of everything. It's how we teach each other what's going on, how we give alerts. It's how we also fight back misinformation. Both of them travel very quickly, and communications is just everything. It's always been the most challenging part, actually, of dealing with any outbreak in any complex public health situation, because you have to react quickly. You have to be able to say when you don't know things. You have to be able to pass along information which can be trusted. And all of that's hard to do, but we have to do it.
And we certainly do. And I want to thank Diana for watching and salute all her colleagues, the medical staff, the communication staff, everybody for what they're doing and for supporting the show as well. Upali is watching and she's on LinkedIn. We're live right now on Facebook, Twitter, YouTube, and LinkedIn. Professor, do you have time for any social media?
I'm a little bit afraid of social media. Well, it's really the time demand. It's funny, the more I communicate, I also have to say the more I appreciate just having downtime to just be quiet and think and so on. So I think, social media is like a global discussion and the world doesn't sleep. And so it's a little bit humbling to be engaged in it.
And you're busy doing the work. So that's another way. Maybe when you're retired and you're bicycling, you'll get into a little social media as well. And I know your team does social media, and HKU is certainly doing a lot. And that's how I came to be working with the team on getting the word out about all the amazing initiatives at HKU. Paula Kiger has joined us from Tallahassee. Have you been?
Yeah, Tallahassee is close to Atlanta, and I love visiting Tallahassee. And we will move back to Atlanta one day, and I expect to continue visiting up there. In fact, I'm thinking of buying a bicycle in Tallahassee. So,
is there a famous bicycle shop in Tallahassee?
Yeah, there's a bicycle maker in Tallahassee. So, in a few years, I may make a visit up there.
Wow. Well, you have to meet our friend Paula. She's on my team. We're doing all these great conversations, but we're also doing conferences and putting them online. And she works with me in that effort. So I know she would love to say hello to you. Ashok is watching from Kerala, India, Professor.
When you were mentioning that I had, bit of a non-Asian way, taken some years off from school. And so part of that time was spent in Tamil Nadu. But it was working with an organization that was spent half of its time on social welfare and half the time working with patients. Or I should say the small group was divided in two. It's the Nilgiris Adivasi Welfare Association is the name of the organization. But we had a clinic close to the Kerala border. And so about once a month we would ride by jeep out there. And again, I have very fond memories of that time and of that area. Very beautiful.
Oh, that's nice. We won't ask you to pick Kerala food or Tamil Nadu food because my wife's from Tamil Nadu and she's a Keralite, but she considers herself very Tamil. So there might be a clash if we had to pick. But do you have good Indian restaurants in Hong Kong?
We do. We have, like many places, good Northern Indian restaurants and Southern Indian restaurants. Most of my friends prefer Northern Indian cuisine, but having spent most of my time in South India, I'm partial to Southern Indian cuisine. So
great to hear that. You're right. When people hear Indian food, they mostly think of butter chicken and tandoori chicken, which is wonderful, but that is North Indian food. And I encourage everybody who's listening to seek out South Indian food in your countries. Of course, now restaurants, especially in places like America, have been devastated by the pandemic. Twyla is talking to Jonathan, asking him about the crisis in America, what's happening in Union Square. Ashok is complimenting my shirt. Thank you. I had to dress up. This professor is very nattily dressed. I have noticed wherever he goes, he puts on a jacket. So I'm sweating here, Professor. I have not worn a jacket on purpose in a while. Sometimes I throw one on for the occasional interview, but I'm still wearing shorts. I believe because you are in Hong Kong and you folks are now back in the office, your colleagues around, you have to dress much better than I have to.
Well, we're like any university, so a lot of people are walking around in short pants, but I do have long pants on.
Thank you. I'm glad to hear that. G-Day says hello. How about this? Twyla, who is a great friend and also has spent time in India and all over the world, she asks, how would you characterize Hong Kong residents as hopeful?
I think that we're in a very complex time in Hong Kong right now, and of course, I think things in terms of the pandemic part have gone pretty well. And I think that most people here recognize that. And I think that are grateful that the number of cases have been kept down. And all in all, the city has done a really good job of keeping everyone informed about what's going on. So it's pretty transparent when there's cases. The government officials meet every day to explain what investigations are being done. And this has really been extremely well received and helpful. It's also clear that the city, coming out of 2019 has had a lot of political tensions and the demonstrations. And I think that, again, these continue in 2020. And so there is a kind of mixture of feelings. And so I don't know. I think it's just easiest to characterize it. Probably most accurate to characterize it is that there's a pretty strong mixture of feelings in the city right now, from person to person.
We've of course seen that the Chinese government itself has several people in Asia have criticized American stand and the way Americans are, often critical of other countries, given the situation with protests here, and the president of America saying he will kind of unleash the the full force of the military on peaceful protesters.
Yeah, no, I mean, this is a very, very troubled time for the United States. And, as an American, it makes me feel really bad to see what's going on in the country. I think that the fact that there have been a number of really troubling incidents is very clear. And the fact that there is racism in the country is very clear. And the fact that we have leadership in Washington, which rather than bringing everyone together, is, somewhat inflaming the situation is also very clear. I do think, though, I want to be fair to the U.S. The issues which the U.S. is so visibly struggling with right now are also not unique to the U.S. When you look at other countries, really very much similar situations exist, and the kinds of tensions which are so visible right now on the television are also there in other countries. And so as someone who's worked internationally, this, you cannot escape from the question almost on a daily basis. What is it that we can do to, bring the divide closer? There are so many strong feelings about whether there is fairness and equity, and we see this being played out in the States, whether there are systematic biases against one group of people or another, and it is a real world challenge. And I see it as one of the public health challenges. I think it's an artificial divide to separate out health from what we're seeing on television. And it is one of the ways that we are trying to teach, I think, or incorporate at our school now, that if we're going to really address fundamentally with health, we can't think of it as simply a biological or scientific issue, but we really have to look at it as a societal issue. COVID was a good example. The riots, what we're seeing in the US, I think, are another example. There's a deep sense of emotional pain. There is a lot of distress. And I think that if you were to talk with people, just talk with people and say, is this what you want? I'm sure every person you would talk with would say no. But how we get out of that, this is hard. But I think this is what public health also needs to focus on. It's not just enough to leave it up to politicians or to others. I think public health has to address this straight on.
We have so many questions coming in, Professor, but I do want to ask you about this idea that racial inequality is a health issue in America. We're seeing, as I said earlier, something like states where there's 20% of the population is Black, but 80% of the victims of coronavirus are Black. Talk about what that means. And you have, of course, been pursuing the issue of health equity for so many decades now. I'm sure even looking at the time you were looking at TB in America, leprosy in America, there was something that was driving you about equality that came from a health perspective.
Well, for anyone who's in public health, you very quickly see that inequities, how we treat each other, is absolutely fundamental to health. And so if we value health and, if we value lives, then you cannot escape that conclusion that the kinds of unfairnesses and the inequities that we see are absolutely fundamental to health. This is not a US issue again. If we look at, the United Kingdom, some of the studies which have been done, which were really foundational to just document these points, were made there. If we look at countries around the world, we look at regions, and we see the disparities in terms of health outcomes, how long people live, the kinds of diseases that they're affected by. Again, we see over and over again that inequities are the basis of it, or at least very much tied to it. And if we look at what's going on in the United States with COVID, it is inescapable that the impact of COVID is much higher in some minority populations. But this is not unique to COVID. This is not a disease-specific issue. If we go back to earlier outbreaks like the 1918 pandemic of influenza, if we go back to other things like smoking, many other diseases, again, we see these same kinds of disparities. And so it tells us it is not the health issue. It is not a fact of the virus. It is really a fact of how we live, how we treat each other, the conditions that people are in. And so this very much makes public health something which has to be thought of in a societal way, in a sociological way, in an ethical way. These are inescapable conclusions.
Professor, we're looking at the Johns Hopkins COVID-19 tracker, which I'm sure you've spent some time looking at. I'm not sure you've seen it recently, but when you look at this, look at the entire planet has been affected by this. You're looking at the numbers. America is, 1.8 million confirmed cases, 107,000 deaths, and you're seeing these numbers. What does this say to you about the world today, where we are, and where we're heading?
Well, I think that there are a couple of things which are, whether we're talking about COVID or not, we often see a picture like this. And one of the things which it tells us is that we often have gaps in information about many places. That's one of the first things which come across. So when we look at the map, for example, we can see that in many parts of the world, we're not quite clear what's going on. But when I look at the map again, the United States is virtually red. The entire area is red. Europe is red. It's so heavily affected. And I think that one of the aspects of COVID, which we are going to have to take some years to figure out, is that there are regions of the world which have had more difficulty dealing with COVID than others. In general, Asia has been pointed out as a region which has done well. And I think that in general, the United States has been pointed out as a country which is really struggling. And when I look at the US and I think about my friends and the different places that I've lived within the country, it is easy to see how in different locations you have different cultures, you have different perceptions. And so COVID itself in some place is seen as an infectious disease. In other places, it is seen almost as a political litmus test. Where do you stand in terms of your response? And so in a certain sense, it attests to the richness of the country, but in another way, it underscores why does a place like the US have so much difficulty addressing an issue like COVID. It's not just the size of the country, it's the fact that for whatever reason, it's very hard to bring the country back together again. And it brings us back to the observation about the riots that we're seeing in different countries, and how what happened in Minneapolis just sort of lit a fire through the rest of the country. And I think, again, these are somehow related phenomena. They are not separate, but they are tied by the fact that these divisions undermine us. They make us more vulnerable. And so again, these are the things which I think about when I see these maps.
Thank you. Ashok says, do you think the WHO did underplay the outbreak in China?
I think that, having spent a number of years there and knowing the kinds of situations which come up to WHO, and then knowing the people that work there, I think I can state some things very clearly, and then there's other parts which I don't understand. The parts that I can state very clearly is that the professionals that work there are really competent. The people that are putting the data, day in, day out work, trying to contain COVID, trying to get information out of countries, they are fully dedicated and they are really good. They work really hard and they're really good. The second thing is that frequently people think of WHO as an independent entity which somehow floats above countries, and so it should be coming down and giving pronouncements and telling countries when they're doing badly or doing well, but somehow exerting control over them. The reality is almost opposite. WHO, in a real way, is very much a secretariat to countries. It is funded by countries. It is seen as a member state organization, so every country feels ownership. And from that perspective, what WHO typically tries to do is to provide public support to any country which is affected. So if we go back to Ebola, we go back to other outbreaks, we go out to other situations, the WHO is really trying to provide support to the affected country. Even if internally it may be unhappy with how quickly information is coming and so on, publicly it will always try to support its member states. And I think that this is, this is in essence a unhelpful thing, because in the long run, countries trust WHO. They allow WHO to come in, they allow WHO to have access that they won't give to other countries, because they know at the heart of WHO's efforts, they're really trying to be supportive. The third factor is that WHO is a UN organization. It's a diplomatic culture. It is not a straightforward scientific institute, but it is really a coming together of countries in the way that the UN does. And in that respect, it can be bureaucratic, it can be slow. And so I have no doubt when the pandemic is assessed on a organization by organization basis, country by country basis, in many respects, WHO will be found to have moved slower than it might have moved. But again, understanding the things which it has to address, I can see why. The final thing, though, that WHO is very much a political organization that has a face. And it does have to both represent the affected countries, but it also has to affect the rest of the world. The rest of the world is anxious when an outbreak happens, and the WHO is the unique organization with access to information. So in that respect, it should be seen as being threading the fine line between being neutral and also being supportive. But the biggest reality of all is that WHO cannot force any country to do anything. If WHO is going to succeed, it's because the countries help it to succeed. If a country does not provide information, and in outbreak situations, it is common that countries act very slowly to get information to WHO at the beginning. So this is not a unique accusation. It really fundamentally depends on that country's willingness to abide by the international health regulations, provide the information. So it's a complex set of considerations. People simply ask, did WHO do a good job or a bad job? And it's really very hard to just give a simple answer, good or bad. You need to understand what is WHO, and then look at those main things.
That was a masterful explanation. Do you worry, Professor, that there is no space for masterful explanations on the internet? People make snap decisions, they do short tweets and make decisions and judgments based on incomplete information.
I worry that we will make decisions based on short-term being upset or angry or short-term gains, when it's really the long-term picture that we have to be concerned about. And so I think that to immediately try to portray WHO as being terrible or it being great, it doesn't do justice to what we need. We need a real organization which is going to be able to adapt to the times, meet the needs of countries, meet the needs of communities and people worldwide, and then provide the help, to allow it to do that. And so, for me, it comes back down to the countries. If you want WHO to be a certain way, provide the support. If you are really upset with it, don't walk away from the table. Stay at the table, voice what you want to see change and help the organization to make that change. It's pretty straightforward.
Thank you. Olinda Rodriguez is watching and says, a very good morning, Sree, and hello to Professor Fukuda. Looking forward to these interesting insights. And Paulo is watching from Vegas. Have you been? I'm sure you have.
Yeah, I've driven through Vegas. I was once when I was on one of my years when I took off, I was sleeping in a car, and I asked the other student to wake me up when we got to Vegas, but he didn't. We drove through, and I've always wanted to go back and visit Vegas, and so I have visited, but not really.
I can't believe that, because of course there are a lot of conventions and conferences in Vegas. So the fact that you escaped all of them is surprising to me. Shashwati says, good show. I watch every morning. And Rick Botello has a brother who's a professor at HKU Dental School. And he's asking about a Cope with COVID movement that he's launching. And he would like you to read about it on LinkedIn. But of course, you're not on LinkedIn. And he said he would suggest that you join LinkedIn for networking purposes, but your network is pretty full, isn't it?
It's reasonably full, but I know your brother pretty well. I meet with him every once in a while.
Oh, wow, small world. I also want to say that this morning I had a HKU day because I interviewed Daniel Chua, who's the head of the music department, and he and I did a call like this, and then I said, I'm interviewing you tonight, and he said, you're having dinner very soon. So this is a very, very nice thing for me to have a Hong Kong day. Let's go into some of the questions here. Our Dr. Kanika Monga says, is there any good data on morbidity, mortality of COVID-19 out yet that you're aware of?
Well, I think there's a huge amount of data out there. You know, there's much more data than I'm aware of, but I think that the actually an amazing amount of information on you know, the relationship of this infectious disease to you know, cardiac function and receptors and so on. So I think that if anything, it's a little bit overwhelming trying to sift through all of this. But I think that much of the epidemiologic patterns that we saw first come out of China in many ways have you know, stood the test of time. You know, we do see that there are high-risk groups such as the elderly and those with underlying conditions, but over time we've also had an understanding which has broadened so that there are younger age deaths in younger age groups, and we've seen you know, a new inflammatory condition perhaps similar to Kawasaki's disease arise in children. And you know, more recently, we've begun to understand in terms of the epidemiology of this infection that, you know, it seems to be a smaller percentage of those who are infected who account for a larger percentage of the other infections. And so, you know, the chances for each of us to transmit infection is not the same. So we're beginning to see all of these nuances much better. But I will say that the amount of information which has come out in 5 months is amazing.
What are your thoughts on the vaccine and where it stands? I know you don't have all the answers. No one has the answers, but your thoughts on the vaccine. And she also says, do you think that data could help shape what to expect, similar for the way we prepare for the flu season?
Yeah, well, I think there are a couple of things. You know, the first fundamental question, is it realistic that we'll have a vaccine? And I think the answer is clearly yes. I think that it is very realistic. The next question, which everybody is wondering about, is when are we going to first see the vaccine? And here it's a little bit hard to tell if you're not actually working on the vaccines. But, you know, you see estimates from anywhere from sometime later this year in 2020 to you know, sometime in 2021 when we begin to first see the vaccine coming out. So I think that those things, you know, are just going to move along as quickly as possible. There's a strong vested interest in the terms of everybody to get vaccine as quickly as possible. But there are a group of issues which are coming up which I don't think we're spending enough time on. If we are expecting to vaccinate some billions of people, it's unrealistic to expect vaccinating everybody, but a significant percentage of the world's population is going to be some billions of people, 3 or 4 billion people. You know, the amount of vaccine which is going to be available in the beginning is going to be quite limited. And so, is that vaccine going to be kept in countries that are making the vaccine? We have seen how one company has contracted with the US, even though it's based in another country. Is that company going to ship it to the US? What are we going to do with the distribution of the vaccine? In 2009, when we had the influenza pandemic, the logistics of handling vaccine and some of the ethical and liability issues came up, turned out to be the most difficult logistical issues that we faced in the 2009 H1N1 influenza pandemic. And I think that here we're going to run into similar problems. There's simply going to be countries who don't know how to handle or don't have the capacity to handle the vaccine. There are going to be a lot of anguish calls that we should be getting vaccine, but I think that we don't have an approach to the distribution. So does that just mean that if you can pay for it, you get it, or if you've signed a contract first, you get it? This is going to have the potential to further inflame the kinds of geopolitical tensions that we see now. And I think also raise a lot of suspicions. Why them and not us? But the other thing which is going on is that we live in a world in which groups of people who are anti-vaccine are, again, very communicative, in close collaboration with each other. And it is clear that the groups which are anti-vaccine are also gearing up. And so it is very easy in this situation in which people's tempers and trust can be volatile to start rumors, put out misinformation, if you fundamentally are against vaccination as an approach. So these are issues which we can clearly anticipate now. And it's important for countries, it's important for WHO and other international organizations to really be planning ahead to expect this and not to just wake up and say, what do we do with this problem? But to, these problems can be anticipated now. And we do need to be thinking about how are we going to address them.
We only have a few minutes left with you. We've got many comments coming in. Lori says, great hearing the talk about WHO. And Olinda says, really appreciate the in-depth explanation of the operation of WHO. Thank you, Professor. And many other comments are coming in. Before you go, I wanted to just tell everyone that you worked at the CDC as well for many years, and where you were running many of the departments that dealt with the big outbreaks and things like that, that now have, you know, SARS, influenza, things, the topics of that nature. And the question I have for you is, when I look at America and you mentioned the vaccine doubters, or, you know, it's almost like the birther controversy around for President Obama. What do you think that is? What effect is that going to have? And what did you learn having watched leprosy? Mostly, I believe it's eradicated, at least in the United States. We've seen some diseases that were eradicated now coming back because of some of this scientific skepticism and so much like climate change denial, isn't it?
Yeah, I think that in the current era that we live in, there are a couple of very difficult and troubling realities and trends. In many ways, we live in an era in which, you know, science is no longer trusted. We live in an era in which authority is no longer trusted. And we live in an era in which it's difficult to distinguish between opinion and what is factual. And in that milieu, we have simply a lot of people saying that what I say is as good as what anybody says. And so, of course, this is the ingredients needed for widespread confusion. And for those of us who have worked in health for our lives, we so value vaccination. You know, vaccine is not the end-all and be-all of preventing disease, but it sure as hell goes a long ways towards preventing a lot of misery and preventing a lot of unnecessary infections and disease. And I think that we are in a very difficult time, because what is really being discussed ostensibly in terms of COVID is a large discussion that I don't trust you, and I don't trust you, and I don't trust you. And what do we do with that? You know, what do we do in a situation in which, again, the top leadership in the country may be talks about injecting bleach or touts medications which don't have any kind of scientific consensus behind it. So I see this as a really troubling confluence of I don't know, trends. I don't know how else to put it in the country. And it's not just the country, it really is worldwide in many respects. But I do think that voicing and using vaccine and supporting it is going to be a big way that we are going to be able to get away from the crisis mentality of COVID. We both need to protect people on an individual basis, but we also need to protect our societies. And I think that part of that means really getting back to a more normal level of activity. And vaccine will be an essential part of that. And so I do hope that somehow we can rally around at least these kinds of activities.
We're seeing here a story from the New York Times a few weeks ago. Vaccine rates drop dangerously as parents avoid doctors' visits. And that's just one example of the crisis. I'm not sure I understand this question. Do you think TRIPS is going to be an issue when vaccine comes out? I'm not sure if that's a acronym or is it just about travel?
No, it's an acronym for some of the trade negotiations which were done as part of the World Trade Organization. And to be blunt, I am concerned whether any of these existing agreements are able to cut through the level of nationalism and distrust that we're seeing right now. We are living in an era again in which what seemingly would have been unimaginable is occurring. And so I don't know whether the TRIPS agreements will hold up or not.
Okay, so we'll give you a chance to give us a final thought, and then we'll let you go, Professor.
No, I think that on the one hand, I've been emphasizing the complexity of things and sort of trying to explain why, at least from my perspective, why some things are. But, to give you a final perspective on these things, I have gone through a number of different outbreaks and a number of different difficult public health situations. And in many ways, the situation is unprecedented, and we, in our lifetimes, we haven't dealt with something like COVID before. But it is also true with every major outbreak in the past. We've also been in a similar situation in which we haven't quite dealt with that combination. And somehow, when we get the right people together, and when we are clear on what we want to have happen, and so if we're clear here that we really do want to reduce the impact of this disease, get back to life as normal, and really in a more collaborative way, then I'm sure we can find the ways to do it. I don't think it's going to be easy. I do think the times are difficult, but I have no doubt that we can achieve it. We're always in a difficult time. There is no time in history when things are easy. And so, it is up to us to figure out how we're going to do it. But if we want to do it, we will.
Thank you so much for spending the hour with us. You helped so many people around the world. We're very grateful to you. We'll let you go, Professor, and just say, I look forward to having a drink with you in Hong Kong or in New York. It may be several months away before we can do that.
Great.
Thank you very much. Bye-bye.
Bye-bye.
That's our guest, Dr. Keiji Fukuda of the University of Hong Kong. We're so grateful to him for his time, his insights, his energy around this topic. He is a health diplomat who helped millions of people with his work, and now is a professor who is much beloved at the University of Hong Kong. And we're so lucky that we could spend time with him here today. Thank you so much for watching. Before you go, I just wanted to say a few things about where we are in the world today. There is so much going on that it's hard to keep up. And I was asked, is this the right time to talk about this issue about health and the global pandemic? And I said, we have to remember that whatever is happening with the protest in America, there is a pandemic and a crisis going on at the same time. It's worldwide, and it's right here in America the fact that America, with its great healthcare system that we think is great, the medical education, people from all over the world come here for healthcare, and that we would be number one in the number of cases, the number of deaths, the disparity, and also the racial injustice of this disease. And I had on my show last Saturday a gentleman named Adam Server, who is with the Atlantic publication, the Atlantic magazine, and he wrote an article that I think everybody should read. The premise was that President Trump cared about this disease even as much as he did, as long as he didn't know who was being affected. As soon as he found out it was Black folks, poor folks, Hispanic folks, that's when he started to reopen the country and push for that reopening. And so even as we look at the injustice in the criminal justice system and look at the problems happening all over this country, we have to remember that the healthcare crisis will not go away. No matter what police reform happens, we, all of us, have a role to play in making sure that there is health equity in this country. And if you're watching from overseas, making sure there's health equity for the minorities in your countries and people who are otherwise downtrodden and not having a chance to have a voice. And during these last few days on my shows, we've had several different experts who have been fighting for racial justice, and they have said to me, Sree, make sure all of us pay down our privilege. And one of the ways I can pay down my privilege is to use platforms like this to connect with people, bring them on the show, talk about the issues, and I urge all of you to send me people who should be on the air. There's someone you know who should be given a platform to talk about any kind of issue that they have not had a chance. This is obviously a very tiny show compared to everything out there, but we can do our part. We work with scroll.in, one of India's leading news and information websites and culture websites. And we have journalists, thousands of journalists who have seen this program. And we want to help different folks, give them a voice. If you know anyone who should be a speaker, who should be a guest, a theme you have, please let me know. We definitely want to talk to them. We'll also be covering very carefully the developments in the next few weeks. And one of the things we did on my other spin-off show on WBAI, Progressive Radio here in New York, we talked to Professor Kimberly Crenshaw, Columbia University professor, who coined the term intersectionality. And she said to me, she talked in so many different ways about the problems in this country, about the inequity in the system. And one of the things we talked about is the importance of saying the names of the men and women who have been killed in this country by the police system. So I'm going to take a minute here, and I hope you will stay with me as I read these names. My son, my 17-year-old son, is one of the people who helps me on the show. He is my intern. And, we worry a lot when he and his twin sister go out into the city during the virus. Of course, they don't go out, but we worry about them being physically attacked. We worry about all kinds of things, as any parent would, but we don't have to have the talk with them. When we say the talk, it's about dating, sex, things like that. But in the African-American community, it's those topics, but much bigger talk. The talk is about police and their community and what you have to do. You have to know how to behave when your car is stopped. How should you interact with the police? What should you say? Keep your hands on the steering wheel. All of those things. Hearing it was heartbreaking because we've heard about the talk again and again and again. So my son put together a list of some of these people whose names we should be saying, and it is not everybody. But I think as we say the names, we understand the power of what is happening in this country today. People are waking up, not just African Americans who've been awake and have been protesting for years, but lots of their allies and others have spoken up as well. I'd love to see more conservatives who have been kind of copying everything the president is saying, echoing everything the president is saying. Speak up for these folks. Let me read some of the names to you. And these are the names put together by my son. Botham Jean, Calvin Munnerlin, India Taylor, Natasha McKenna, Alton Sterling, Tamir Rice, Sandra Bland, Walter Scott, Freddie Gray, Philando Castile, Breonna Taylor, Eric Garner, Mike Brown, Trayvon Martin, George Floyd. And that's just a tiny, tiny sliver of the names we know and the names that have become names that people know in this country. Worldwide, they don't know the names, but everybody should know these names. Some of them might be familiar to you. Eric Garner was the man selling cigarettes, loose cigarettes, and a police officer choked him to death as he said, "I can't breathe." We have Botham Jean, who was sitting in his own apartment eating dinner when a police officer broke in, confused about where she was because she lived in the same building, and shot him to death. Calvin Nunnerlin was a security guard at a dollar store. He asked one of the patrons to please put on the mask before coming in, enforcing the social distancing guidelines of this president's government, and he was shot to death. And already that story has already been forgotten. And so many cases like that, Ahmaud Arbery, so many cases. And we need to pay attention to these cases. One of the things that Professor Crenshaw said to me that I'll never forget is she said, "Do you know that these are very rarely prosecuted, the police, and if they are, they're found guilty, they're not found not guilty. And in a rare case where there is a conviction, the jury awards a settlement that is knocked down to almost zero." She also said that recently in Minneapolis, there was a case of a police shooting and the family got $20 million. That sounds great, as not great, but it sounds like a positive achievement in terms of the system. But that victim was a white woman who had been shot to death by the police. So this is the reality on the ground today. And I wrote my newsletter piece this week. My headline was, "My beloved America is on fire." And as my friend Sonny Slaughter said to me on the New York Times read along this week, every Sunday we read the New York Times read along. We read the New York Times out loud on Facebook. She said, "Don't ask me and don't ask your Black friends, what can I do? Ask yourself, what have you been doing all this time? Because yes, America is on fire, but Black people have been on fire for a very long time." And I want you to all think about that and what is your role in this and what can you do in this to help make America a better place. Not make America great again, because it wasn't great the way the president thinks, but to think about how can we make America a better place, make it live up to its own ideals. And we all have a role to play in that. Thank you for listening to me. Thank you for being here. Thank you for sharing this show. Thank you for all you've done to support it for 84 straight days. We want to hear from you. You have my email address right on the screen. Please reach out and let me know how I can help you. Sree@sree.net is my email. My YouTube channel is youtube.com/SreeNet. You can find all our conversations on there, including the Sunday New York Times read along. Nobel laureate Joe Stiglitz was with us, and he was fantastic in talking about racial inequality that comes from asymmetrical access to information. That was the subject, or one of the many reasons he won the Nobel Prize in economics. And we're seeing that come to life today in a very problematic way. I just have another minute of your time to wind up here. We want to thank our sponsors for their support, for being very generous. We want to thank artandco.net. Get involved in the world's largest online art auction, fundraising for COVID-19 victims and helping independent artists. Artandco.net. Artandco.net. The auction ends on June 19th. And finally, I'm offering the world a free academy, Muckrack Academy, Fundamentals of Social Media class for journalists, PR pros, and everyone can join. You don't have to be a journalist. Free certification of any age. If you have children or you're an adult, you can all benefit from this. mrac.co/social, mrac.co/social. If you have a question, you can ask me. Thank you so much for watching. Please subscribe to my YouTube channel. And last thing before I go, want to show you this is my WhatsApp, not group, because WhatsApp, as we know, has many groups, including lots of groups with your racist uncles and aunts. This is not that. This is just an alert. Every time I'm live, we send you a little alert saying we're live on the internet. So you can join and you can always unsubscribe if you don't want it. So thank you very much for being here. I'm so grateful to you, and we'll see you again soon. Thank you, thank you, thank you. Bye-bye.